Everyone, this is Sean with the MassSupport Network here with the Massachusetts Public Health Report for Friday, April 2nd, 2021. So unfortunately, we are steadily trending back upwards right now. Rise of over 5,000 more active cases this week than last week, which is a lot more, and we don't need more right now. Through things looking at quarantine, this is people who are undergoing monitoring or quarantine due to COVID exposure or waiting test results. Last week we were at 9,700, and this week we are just over 11,000. And it's this one trending upwards also especially disturbing because people who are vaccinated, fully vaccinated, which something like almost 20% of the state is, don't need to quarantine after exposure or travel or anything like that. So this means just more and more cases out there. In terms of actual people in isolation, these people with confirmed COVID cases, we're just over 27,000, and now we're just under 32,000. So, a lot more as we steadily ramp up here. The average age of hospitalizations has gone up 1 year to 64. The average of deaths, though, is staying steady at 77. The average age of a new case is down to 34 years old at this point. It's getting younger and younger, possibly a lot due to vaccinations in the older population driving things down. When we look at our hospital data, we can see a lot more steady upticks here with about 70 more hospitalizations, almost 20 more new people in ICU, and intubation staying roughly the same. So this is not going to move as fast as cases will increase, but as those get higher, we'll start to see these trend upwards more as well. Testing is staying about level, just up around 1 1/3 day, 32 hours or less on average, which is good, but if that's due to reduced testing, that's not great. We look at our contact tracers. This week, things are again staying more or less the same as they have, perhaps slightly more cases reached total, but the amount reached in 1 day is taking slightly downward, and as case counts get up, there's only so much they can reach out to in a single day, and many more people will, of course, never be reached, as these the last 2 weeks numbers have steadily gone down a little bit from where they were before, reaching almost less than 1% of fewer people this past week than the one before. So looking around the state at the incidence rate by county, this is the average daily incidence rate, the number of new cases per 100,000 people per day of the last 2 weeks, and every county increased this week. There is no county that trended downwards. Some of these jumped up kind of a bit, like Barnstable and the Berkshires. Some less so. Worcester only turned it up a little bit, for example. But by and large, there was a significant jump. Last week, the statewide average incidence rate was 21.5 new cases per day per 100,000 people. Now it's 25.6. That's a pretty big jump there. It's been a while since we've seen a jump of that size, and that's too much. When we look at our percent positivity, splitting this into the three tracks of the light blue line of higher education screening testing, the dark blue line of overall testing, and the gray line of statewide testing that has higher education removed. See, things are continuing to go up here. Higher education even ticked up slightly from 0.2% to 0.3% this week, which when that starts to go up too, that's actually kind of a decent sign about what's going on, because it's all screening testing. That's testing done without regards to exposure or travel or anything like that, just regular testing to sample the population. And that's kind of evidence of the way things are moving up again. We've gone over 4% when we're not counting higher education testing, and that is unfortunate. That's getting closer to generally 5% is where we say that that's into the critical area. We need to start thinking about moving backwards, which many people are reluctant to do at this point. So we need to kind of buckle down for a few more weeks if we want to stop this from setting back all of our progress. So this is the Massachusetts 7-day average. I usually don't, the 7-day average for new cases, I usually don't display the full course of the pandemic here, or the full course that I have state data for. And this is, yeah, this kind of shows, where we're at right now. And we're kind of back again into where we were in early November with the recent upticks we've seen. And that's not good. We made a lot of progress there. We fought our way back to late October, and things are trending back up. So it's one of those things where for a long time we've been saying it'll get worse before it gets better, and now it feels like we're back in one of those points where things look like they are going to get a little bit worse before they get better. So one last thought to go into our weekend with. On Monday is the last part of phase 2 in the vaccine rollout in Massachusetts. So if you have anything that qualifies you for a priority group, whether you are 55 years or older, you have any of the medical conditions that would qualify you, if you have any of, if you work in any of the specific sectors, such as grocery, transit, education, any of those, you can, now's the time to try to find a vaccine dose before the gates open to the entire state as of the 19th of April. So that's just a short period of time there. I know that that appointments are going to be kind of scarce still, but this is the time for that. All right, and for more of the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.